Step number 1, Introduction and Affiliation. Introduce yourself to the patient. Ma'am, good morning. I am Vanjo Marpipito, a registered nutritionist dietitian. Step number 2, tell the patient about the test you're going to conduct. Tell the patient what is the test all about. Ma'am, today we'll assess your waist to hip ratio in order for us to determine whether you are at risk or below at risk in getting cardiovascular diseases such as diabetes and heart disease. Step number 3. Ask the patient to start the measurement. Ask permission to the patient to start the measurement. Step number 4. Ask permission to remove things inside the patient's pocket or ID slings. If the patient is wearing an ID sling, ask them kindly to remove them and any things inside their pockets. Step number 5. Measuring of the waist circumference. To start with measuring the waist circumference, identify the upper hip bone. Find this spot by placing your hand on the waist, but if they are not comfortable, they can place their own hand on their waist, then slowly moving them downwards while pressing gently until you feel the top of the hip bone, which is called the iliac crest. Measure the waist circumference between the lowest rib and the iliac crest. Ensure that the measuring tape is not slanting to avoid erroneous measurement. Also, make sure that the tape is not too tight or not too loose to the client's body. Ask the client to relax the abdomen and exhale, and inhaling while measuring is not allowed. Record the measurement to the nearest centimeters. Step number 6. Measuring of the hip circumference. In taking the hip circumference, find the widest part of the buttocks. If the patient is uncomfortable, then they can place their own hand to locate their buttocks. At this part, place the tape and measure around the buttocks and hips. Record the finding to the nearest centimeters. At this point, you can do the measurement twice for accuracy. Step number 7. Interpretation of the result. At this point, the waist to hip ratio is ready to be derived. Interpret the computed waist to hip ratio using the World Health Organization cutoff values. When interpreting the result, the measure should provide full details about the interpretation. The measure should also provide what are the possible consequences if the patient's result is increased, substantially increased, or normal. Step number 8. Express gratitude towards the patient. Ma'am, thank you and thank you for your cooperation.